these patients either seek the care they fail to seek the care they need, or provide it to them. We provide it to them through our emergency departments. At Johnston Memorial Hospital, approximately 8.5% of our payer mix, patients we actually treat, are either charity or self-pay. Of even greater concern is the number of people living in our community who have no insurance. That's over 24% of the population that we serve. That would seem to indicate that many of these people are delaying or avoiding receiving health care services they need to maintain their health. Extending coverage to this population would enable these patients to find a medical home, begin receiving preventive care from a primary care provider, and thus receive less expensive care in a more appropriate setting. The decision that you're facing today to close the coverage gap and provide insurance coverage to a larger population of Virginians is one that will have a dramatic impact on Johnston Memorial Hospital and the community that we serve. JMH is one of the largest employers in our region, and it's been a significant part of our local economy for over 100 years. JMH alone contributed nearly $109 million to the economy of our surrounding counties in Southwest Virginia in 2010. Johnston Memorial Hospital is proud to be a major supporter of the economic health of Washington County and Southwest Virginia as a whole. The team members who make up this hospital are also members of the communities they serve. When the hospital succeeds, the communities thrive along with it. The opposite is also true, and Johnston Memorial Hospital is not immune from these challenging financial times in healthcare. We currently have 100 fewer full-time equivalent positions today than we did 1 year ago. We've reduced positions through attrition, reduced hours, and various other cost-saving measures. As a healthcare system, Mountain States Health Alliance as a whole has 750 fewer full-time equivalent positions than we did 1 year ago. As indicated by the economic impact study I just referenced, these are high-quality, good-paying jobs that are no longer contributing to the economic stability of our region. Next year, Johnston Memorial Hospital will incur an estimated $4 million in federal cuts, and in 2016, an additional $4.7 million in cuts due to the Affordable Care Act and other Medicare changes. Should you make the decision to close the coverage gap and bring our Virginia dollars back home, nearly $800,000 would be returned to JMH next year and $1.6 million in 2016. If you choose not to close the coverage gap, we'll have to absorb that additional $2.4 million in cuts through 2016. That means even more jobs, services, and benefits to our community will be at risk. Just yesterday, in an online issue of Becker's Hospital Review, it was noted that 7 acute care hospitals and health systems have filed for bankruptcy or announced their closure in the first quarter of 2014. This is an example of the tenuous economic climate in which healthcare providers operate. Our hospitals in far Southwest Virginia are no exception. It's absolutely critical to Johnston Memorial Hospital, to Mountain States Health Alliance, and to the communities and patients whom we serve that Virginia find a path forward that closes the coverage gap and returns our dollars home to the Commonwealth. I applaud your efforts through the Marketplace Virginia approach, as well as the recommendations of our governor. Whatever form the final outcome may take, it's important that we do something and that we do it now. We must find the Virginia way of covering hundreds of thousands of people who are uninsured, and we must do it with money that we as Virginians are already paying. Thank you for your time and attention. Happy to answer any questions.
Chairman, Dr. Murray.
Mr. Chairman and members of the committee, thank you for allowing me to testify. I'm Sterling Ransom, a family physician from Deltaville and president of the Medical Society of Virginia. MSV supports efforts to reform and expand Medicaid to close the coverage gap for our uninsured fellow citizens. Today I speak on behalf of over 11,000 members who are the clinicians who practice in all specialties and who see patients every day in every corner of the Commonwealth. MSV's vision is twofold: to make Virginia the best place in which to practice medicine and receive care. Fulfilling the receive care portion of the MSV vision statement is a predominant factor in our advocacy efforts to find ways of covering the uninsured in Virginia. During the past General Assembly session, I spoke with many of you and many of your colleagues in the House about how to get our patients the care they need in the correct setting, which is not always the emergency department, and also how to address their chronic health care problems earlier before they become emergencies. I've often mentioned a patient of mine who I treated for many years. In 2008, lost both his job and his health insurance. Several years went by before his wife was able to convince him to visit the office to see me, and even though he still lacked his health insurance, when I saw him, it was immediately apparent that he was gravely ill. His refusal to seek medical care and visit a physician was due to his fear of financial insolvency for his family due to medical bills. He died 18 days after our visit of a bile duct cancer. Well, I don't know if I'd been able to see and treat him earlier in the course of his disease, whether or not he would have survived. At the very least, I could have reduced his suffering. I think each of us would agree that the Patient Protection and Affordable Care Act is far from perfect. Physicians would also add that Virginia's Medicaid's low reimbursement rates and excessive administrative requirements preclude some of our colleagues from seeing Medicaid patients. However, railing against the PPACA and Medicaid in its current form doesn't help our fellow Virginians get the medical care that they desperately need. On previous occasions, MSV has weighed in with the Merck, DMAS, the Secretary of Health, about common sense reforms that from a physician perspective would improve the efficacy of the program and efficiency of the program and make it easier for physicians to see and care for our patients. We've seen progress on many fronts. The free market principles embedded in the proposals you're considering are consistent with our interest to improve the efficiency of the Medicaid system. We appreciate the Senate's efforts to close the coverage gap. Physicians are committed to being part of the conversation to find solutions that work for our practices, for our health systems, and most importantly, for our patients. We believe that closing the coverage gap is an integral part of that equation. MSV looks forward to continuing to work with you, other legislators, and our partners in the healthcare and business communities to reform Medicaid and find a Virginia way to cover the uninsured, thus helping to make Virginia the best place in which to receive medical care. Thank you.
Thank you, Doctor. Next speaker is Dr. Donald L. Hyman, Danville County, Richmond. There. Okay. Next, followed by Lori Piper, Arlington, uninsured. Again.
Good afternoon, Mr. Chairman and members of the committee. My name is Lori Piper, and I want to thank you for the opportunity to share my story with you briefly today, and to tell you why it is so important for myself and for thousands of other Virginians like me that we expand the access to health insurance coverage in our state. I know it's easy to get mired in details. There's a lot of numbers. But this isn't about politics, and it's not a partisan issue. It's a human issue and an economics issue, as everyone before me has already stated. This is about real lives of real people who live in our community and are struggling to deal with hardship that often begins a spiral into poverty. That begins with lack of good health care coverage for preventive care, for maintenance of chronic illnesses, and other things such as this. I'm here today to tell my story so that you can better understand how the lack of insurance coverage impacts the daily lives of ordinary, hardworking people all across Virginia. I never would have imagined that I would find myself in the situation that I'm in today. I am a well-educated person, and I went to good school believe in the value of work and self-reliance. I was raised that way, and I've lived on those values my whole life. It's difficult when I hear some political leaders and others refer to someone like me as a taker, someone who doesn't want to work and would rather just depend on the government to take care of me. Speaking for myself, that couldn't be further from the truth. And I think only someone who hasn't faced this type of adversity in their life could say something like that. I hope that my story will make people think twice before they make those type of judgments. I also want to say that this type of story, you know, if it happened to anyone, illness does not discriminate. It happens across all social, economic, and racial gaps, or I'm sorry, not gaps, but groups. I tell my story in the hope that it will give people, especially those like yourselves, who are in a position to make a change, an opportunity to view this from another perspective. Until about 5 years ago, I was a business executive in data management and security. I worked hard, I loved my job, and I loved my independence. Life was pretty good, and I was earning a good living and making big plans for my life and my career. But that all changed when I was diagnosed with a debilitating autoimmune disease, and in a very short time, my health deteriorated significantly, and my life changed as well, needless to say. I lost everything. At this point, I have lost everything that I spent my life building. My health, my career, my income, my sense of purpose, and my hope for the future. A grueling course of chemotherapy became what I now like to call the beginning of the end. Unfortunately, after the chemo, my condition worsened dramatically, and I became so sick that I literally couldn't hold the job. Although I tried very hard to. I worked a number of jobs that I was released from solely due to my illness. That's when everything spiraled out of control. After losing my job, I lost my health insurance. I wasn't able to seek treatment that I desperately needed to maintain my condition or even maybe improve. And around the same time, my mother passed away, who was my main source of not just family support, but economic support as well. My circumstances became so desperate that I became homeless. So I found myself caught in a situation that I never imagined. A nightmare, you could say. I needed medical treatment to manage my health and get back to work. But without a job, I could not afford health insurance. Without a job and access to insurance, I pretty much had nowhere to turn. As a single adult with no income, I do not currently qualify for Medicaid, and I cannot afford the health plans that are available through the federal health care exchange. Specialists will either not see an uninsured patient. I was actually told by many when I called that we won't see you if you don't have insurance. Or they charge such an exorbitant fee that I can't even